Thank you, Chair, for giving me the opportunity to update the board on what's happened. And the last time I gave a chief executive report was 2 months ago, on March the 11th in Banbury. And I can tell you lots has changed in the past 2 months. One of them being that we now have to have a public board meeting using Teams. And I must say that it's been an emotional roller coaster, I think, for all of us, but also for me personally, with moments of deep sadness and moments of extreme pride and hope. But let me start with at least the moments of deep sadness. As the board knows, we've lost a number of staff members, and I want to pay tribute to those people. And my thoughts are with the family, the friends, and the close working colleagues who are deeply affected by this loss. They can count on all the support of the trust. We've given them a lot of support, and we will keep doing so. But those have been moments of extreme sadness for all of us. It was a roller coaster, so we also had really high moments of, I think, pride of what we've been doing as a one team at OUH, with some really heartwarming stories of patients that have survived the COVID-19 infection. And if you read those stories, it just shows how amazing our staff is. They make patients feel safe, feel loved, despite all of the challenges of working with protective personal equipment. And the working environment has significantly changed for our staff. And despite all of that, patients still feel very well served. So I think it's a great sort of feedback to hear as an organization that we're able to provide that amazing service even in very challenging times. We also had a lot of support from the hospital's charity, an army of volunteers that coordinated lots of donations and support. Support in terms of personal protective equipment donations, food and drinks, even flowers. And we needed lots of people to actually bring those donations to staff members that could use it when they were working in difficult circumstances. But that has been extremely appreciated, and I want to thank all of the people and the organizations that donated their time or other support to the trust in these difficult times. You said earlier, Chair, that there's a clear sort of shared purpose, a focus and a commitment that we've all shown during this period, but also changed a lot of how we actually take care of our patients. A lot of our patients are now seen using video conferencing facility, a bit similar to what we're now using for the public board. We're in the top 10 number of trusts that are using that technology to actually help patients remotely. We've rolled out tablets for patients that have to be in the hospital and allow them to stay in contact with friends and family, again, through a digital channel, because personal visits we had to restrict. There's been an amazing effort to free up capacity in the trust to take care of COVID-19 patients. We developed a peak plan that fortunately we never had to use. We only used 25% of our peak capacity. But then on the other hand, the epidemic will last longer. So we're keeping some of that capacity now in place so we can always have enough beds to give oxygen to patients, or if really needed, to admit them to an intensive care bed. While we were freeing up the peak capacity, we also maintained capacity for emergencies and other urgent treatments. Of course, the maternity services kept running, but also we've kept the urgent cancer treatments going, so that also non-COVID-19 patients that needed care could rely on the trust for services. And I'll probably end up my chief executive brief by saying that this common purpose, focus, and dedication was not only the trust, it was also in collaboration with the Medical Sciences Division, who put all their resources on COVID-19 research, very much also supporting the clinical care that we are delivering in the trust. And I'll just pick out a couple of examples. As most board members know, the Oxford vaccine is one of the first vaccines that's gone into clinical trials. So after the Jenner Institute developed the vaccine, a large group of people started looking at how to test the vaccine in volunteers. And the large group of people included medical students, researchers, other staff members. They were supported by the Estates Department to create a clinical trial unit in the old John Waring ward. And I'm very proud to announce that the first trial, all the volunteers have been vaccinated, about 1,100 volunteers. And we're now preparing a large-scale phase 3 trial with even additional space, a pop-up clinic on the Churchill site, to be able to deal with that volume of volunteers that have to be vaccinated. So let's cross fingers, because I think we all in the world actually is hoping for an effective vaccine. And we're hopeful that our vaccine may actually work. I'll pick another sort of collaborative effort, which was actually critical also for vaccine development, is the testing capabilities, both detecting the virus as well as detecting antibodies. And again, people from the Medical Sciences Division and the Trust have been working day and night to validate tests to be able to do the virus detection and the antibody detection. And again, very proud to inform the board that this week we will have tested about 8,000 staff members, even if they don't show any symptoms, on whether they have the virus and whether they have developed antibodies against the virus. And we'll be able to update the board on the results of that mass testing as soon as we have the results back. Finally, I would like to end with saying also that we're not only looking at tests and vaccines, but also participating in clinical trials to find a drug that could help manage this disease. Because as you know, currently we basically give oxygen and hope that patients will fight the virus on their own with their own immune system. But we're participating in national clinical trials, seeing if drugs could be effective. And again, we hope to see results of that in the next couple of weeks or months. So I want to finish this with, again, saying a huge thank you to all of the staff across the Trust, the university, but the broader health and social care system, also working very well with the local authority to sort of mount a massive response to COVID-19 and start looking at the continued service to patients despite these challenging times for patients that need access to healthcare. And also thank a lot of the volunteers and the charities for supporting us in doing that.